You feel fine, your routine blood work looks normal, your doctor says everything is okay. But inside your body something is happening, silently, invisibly. A biological process that started years ago is now accelerating. It is damaging your blood vessels, destroying your neurons, weakening your immune system, and setting you up for heart attack, stroke, cancer, and dementia. This process is the chronic inflammation. And by the time it shows up on standard medical tests, it has already been destroying your tissues for a decade. A 2023 study published in Nature Medicine followed 18,000 adults over 60 for 10 years. The researchers measured inflammatory markers at baseline and tracked health outcomes. Adults in the highest quartile for inflammation had cardiovascular disease rates that were 340% higher, dementia rates that were 280% higher, cancer rates that were 210% higher, and all-cause mortality that was 250% higher. All of this despite having normal cholesterol, normal blood pressure, and normal fasting glucose when the study began. The inflammation was killing them, but standard medical screening missed it completely. By the end of this video, you are going to know the 7 early warning signs that your inflammation is already out of control. You are going to learn which specific tests measure inflammation accurately and which conventional tests miss it entirely. And you are going to understand the evidence-based interventions that reverse chronic inflammation at any age. If you want to identify a threat you cannot see before it destroys your health, hit the like button right now. And if you are serious about preventing the diseases that kill most people over 60, subscribe to this channel. Most doctors will not test for inflammation unless you already have symptoms, but by then the damage is irreversible. I am going to show you how to detect it early and stop it. So subscribe and let us get into the biology. I want to be clear before we go further. Acute inflammation is not the problem. When you cut your finger, it swells, becomes red, hurts. That is acute inflammation. It is protective. It fights infection. It promotes healing. It resolves within days. This is normal immune function, but chronic inflammation is different. It is low grade, persistent, and destructive. It never resolves. It just simmers at a level too low to cause obvious symptoms, but high enough to damage tissues progressively over years. The research on chronic inflammation and aging has been exploding over the past 2 decades. A landmark 2000 study in Circulation established that inflammatory markers predicted cardiovascular events better than cholesterol levels. Adults with elevated CRP reactive protein had heart attack risk that was 3 times higher than those with elevated LDL cholesterol. The inflammation was a stronger predictor than the risk factor everyone focused on, but almost no one was measuring it. Here is what makes chronic inflammation so insidious. It produces no pain, no fever, no obvious signs. A 2019 study in the Journal of the American Medical Association measured inflammatory markers in 12,000 adults who reported feeling completely healthy. 42% had inflammation levels associated with significantly increased disease risk. They felt fine, but their bodies were being destroyed from the inside. Let me explain what chronic inflammation actually is. Your immune system has 2 modes: acute response to threats and resolution after threats are eliminated. In chronic inflammation, your immune system gets stuck in activation mode. Immune cells release inflammatory cytokines continuously. IL-6, TNF-alpha, IL-1 beta. These molecules are supposed to be released briefly during infection or injury, but in chronic inflammation they circulate at low levels constantly. Those cytokines damage tissues directly. A 2018 study in Cell Metabolism found that chronic exposure to IL-6 disrupted insulin signaling in muscle and liver cells. The cells became insulin resistant not from excess calories but from inflammatory signaling. TNF-alpha damaged endothelial cells lining blood vessels. The vessels became stiff and atherosclerotic. IL-1 beta activated microglia in the brain. The activated microglia destroyed synapses and promoted neurodegeneration. Think about what that means. Even if you eat perfectly, even if you exercise, even if you maintain normal weight, if you have chronic inflammation, your tissues are being damaged every single day. Insulin resistance develops, atherosclerosis progresses, neurons die, and you feel nothing until the damage crosses a threshold and manifests as disease. A 2020 study in Nature Aging measured inflammatory markers and biological age using epigenetic clocks. Adults with high inflammation had biological ages that were 7 to 12 years older than their chronological ages. The inflammation was accelerating aging at the cellular level. Every system was deteriorating faster than it should. Now here is where I want to challenge what most people believe. The conventional wisdom is that inflammation is caused by infection or injury. And acute inflammation is, but chronic inflammation has completely different triggers. A 2021 meta-analysis in the Lancet identified the primary drivers: visceral adiposity, poor diet, physical inactivity, chronic stress, sleep disruption, gut dysbiosis, environmental toxins. Not infection, not injury, lifestyle and environment. So the myth is not that infection causes inflammation. The myth is that chronic inflammation in older adults is primarily driven by infectious or autoimmune disease. It is not. For 80% of people, chronic inflammation is driven by modifiable behavioral and environmental factors. A 2022 study in JAMA Internal Medicine found that adults who optimized all modifiable factors reduced inflammatory markers by an average of 68% within 6 months. The inflammation was reversible. Here is the second reframe. Most people think inflammation is something you can feel. If it is inflamed, it hurts. But chronic systemic inflammation is painless. A 2019 study in pain medicine compared inflammatory marker levels to pain scores. There was no correlation. People with CRP levels in the 90th percentile reported the same pain levels as people in the 10th percentile. The inflammation was systemic, not localized. It was damaging organs, not producing pain. And the third reframe, people believe that routine blood work detects inflammation. Your doctor checks your white blood cell count. It is normal. So you assume you do not have inflammation. But white blood cell count only detects acute infection. A 2020 study in clinical chemistry found that 78% of adults with chronic inflammation had completely normal, complete blood counts. The inflammation was not elevating white cells. It was activating them differently. Standard tests missed it entirely. So let me walk you through the 7 warning signs that your inflammation is already out of control. These are not diagnostic. Only specific testing confirms inflammation, but these signs predict elevated inflammatory markers with high accuracy. And if you have 3 or more, you need testing immediately. Warning sign 1. Persistent unexplained fatigue that does not improve with rest. You sleep 8 hours, you wake up tired, you rest during the day. The fatigue persists. A 2021 study in brain behavior and immunity found that inflammatory cytokines, particularly IL-6 and TNF-alpha, disrupt energy metabolism in cells. Mitochondria cannot produce ATP efficiently. The result is profound fatigue that no amount of rest resolves. Adults with CRP above 3 mg per liter had fatigue scores that were 73% higher than those with CRP below 1. Warning sign 2. Difficulty losing weight despite calorie restriction and exercise. You eat less, you move more. The scale does not budge. A 2019 study in obesity found that chronic inflammation blocked weight loss through multiple mechanisms. Inflammatory cytokines impaired leptin signaling. The brain could not detect satiety. They promoted insulin resistance. Glucose was stored as fat instead of burned. They activated stress pathways that elevated cortisol, and cortisol drove visceral fat accumulation. Weight loss required reducing inflammation first. Warning sign 3. Brain fog and difficulty concentrating, especially in the afternoon. You struggle to focus. You forget words. You lose your train of thought. A 2020 study in molecular psychiatry found that peripheral inflammation activated microglia in the brain. Activated microglia released inflammatory mediators that disrupted synaptic transmission. Cognitive processing speed slowed by 18 to 24% when CRP was elevated above 2 milligrams per liter. The brain fog was not psychological, it was neuroinflammation. Warning sign 4. Joint stiffness and achiness, especially in the morning. You wake up stiff, it takes 30 minutes to loosen up. You assume it is arthritis. But a 2018 study in arthritis and rheumatology found that 62% of adults with morning stiffness had no evidence of osteoarthritis on imaging. They had synovial inflammation from systemic inflammatory cytokines. IL-1 beta was accumulating in joint fluid, causing pain and stiffness without structural damage. Anti-inflammatory interventions resolved symptoms completely. Warning sign 5. Disrupted sleep with frequent waking and non-restorative sleep. You fall asleep, you wake at 2 a.m., you cannot get back to sleep, or you sleep through the night but wake unrefreshed. A 2019 study in Sleep Medicine Reviews found that inflammatory cytokines disrupted sleep architecture. IL-6 suppressed deep sleep, TNF-alpha fragmented REM sleep. Adults with CRP above 3 had deep sleep duration that was 40% lower than those with CRP below 1. The inflammation was destroying sleep quality. Warning sign 6. Digestive issues, including bloating, gas, irregular bowel movements. You feel bloated after meals. You have gas. Your bowel habits change. A 2021 study in gut found that systemic inflammation and gut inflammation were bidirectional. Inflammatory cytokines increased intestinal permeability. Gut bacteria and endotoxins leaked into circulation that drove more systemic inflammation, which damaged the gut lining further. Breaking this cycle required addressing both gut health and systemic inflammation simultaneously. Warning sign 7. Skin changes including increased bruising, slow wound healing, or persistent redness. You bruise easily. Cuts take weeks to heal. You have redness on your face or chest. A 2020 study in the Journal of Investigative Dermatology found that chronic inflammation impaired tissue repair. IL-6 suppressed fibroblast activity. Wounds healed 60% slower when CRP was elevated. Inflammatory cytokines also damage capillaries. Bruising occurred with minimal trauma. The skin was showing what was happening systemically. If you have any 3 of these 7 signs, you likely have chronic inflammation. If you have 5 or more, your inflammation is severe. These are not vague symptoms. They are specific manifestations of inflammatory cytokine activity in different tissues. Here is what most people do not realize. Standard medical tests do not measure inflammation adequately. A 2021 study in clinical chemistry compared standard blood work to inflammatory biomarker panels. Complete blood count, metabolic panel, lipid panel, and hemoglobin A1C detected inflammation in only 23% of cases where it was present. 77% of people with significant inflammation had completely normal routine labs. Here are the 5 specific tests that accurately measure chronic inflammation. Test 1. High sensitivity CRP, not regular CRP. High sensitivity CRP, or HS-CRP. This measures CRP down to 0.1 milligrams per liter. A 2019 study in Circulation established risk thresholds. Below 1 milligram per liter is low risk. 1 to 3 is intermediate. Risk above 3 is high risk. Above 10 indicates active tissue damage. This is the single most validated inflammatory marker for cardiovascular and all-cause mortality risk. Test 2. Erythrocyte sedimentation rate, or ESR. This measures how quickly red blood cells settle in a test tube. When inflammation is present, blood proteins change, cells settle faster. A 2020 study in the Journal of the American Geriatric Society found that ESR above 20 millimeters per hour in adults over 60 predicted disability and mortality independently of other risk factors. Normal is below 20 for men and below 30 for women. Test 3. Interleukin-6 or IL-6. This is a specific inflammatory cytokine. A 2018 study in JAMA found that IL-6 predicted dementia risk better than any other biomarker. Adults with IL-6 above 3 picograms per milliliter had dementia incidence over 10 years that was 2.7 times higher than those below 1.5. This test is available through specialty labs. It is not routine, but it is extremely informative. Test 4. Tumor necrosis factor alpha or TNF-alpha, another specific cytokine. A 2019 study in atherosclerosis found that TNF-alpha predicted cardiovascular events independently of CRP. Elevated levels indicated vascular inflammation even when CRP was normal. Threshold for concern is above 8 picograms per milliliter. Test 5. Omega-3 index. This measures the percentage of red blood cell membranes composed of EPA and DHA omega-3 fatty acids. A 2020 study in prostaglandins, leukotrienes, and essential fatty acids found that omega-3 index below 4% was strongly correlated with elevated inflammatory markers. Above 8% was associated with low inflammation. This test reflects both dietary intake and the body's inflammatory state, because inflammation consumes omega-3s rapidly. When these 5 tests are ordered together, they provide a comprehensive inflammatory profile. A 2022 study in clinical chemistry and laboratory medicine found that this panel detected chronic inflammation with 94% sensitivity. Almost everyone with inflammation had abnormalities on at least one test. Here is what the research shows about reversing chronic inflammation. A 2023 randomized trial in the Lancet assigned adults over 60 with elevated CRP above 3 to comprehensive anti-inflammatory intervention versus standard care. The intervention had 5 components: dietary modification, exercise, sleep optimization, stress management, targeted supplementation. After 6 months, the intervention group had CRP that dropped by an average of 64%, IL-6 dropped by 52%, TNF-alpha dropped by 48%. The inflammation reversed. Another study in 2022 in JAMA Network Open followed adults who implemented anti-inflammatory interventions and tracked outcomes over 5 years. The intervention group had cardiovascular event rates that were 58% lower, dementia incidence that was 47% lower, cancer incidence that was 34% lower, and all-cause mortality that was 41% lower. Reducing inflammation did not just improve biomarkers, it prevented disease and extended lifespan. Here are the 7 evidence-based interventions that reverse chronic inflammation. Intervention 1. Adopt an anti-inflammatory diet, emphasizing whole foods and eliminating processed foods. A 2021 study in nutrients found that a Mediterranean-style diet reduced CRP by 32% within 12 weeks. The key components were high vegetable intake, fatty fish 3 times per week, extra virgin olive oil, nuts, limited refined grains and sugar. Inflammatory foods to eliminate included processed meats, fried foods, refined carbohydrates, excessive omega-6 oils. Intervention 2. Exercise 150 minutes per week, combining aerobic and resistance training. A 2020 meta-analysis in sports medicine found that regular exercise reduced inflammatory markers by 25 to 40%. The effect was dose-dependent. More exercise produced greater reductions, but even 30 minutes daily of moderate intensity walking lowered CRP significantly. Intervention 3. Optimize sleep to 7 to 8 hours per night with high-quality deep sleep. A 2019 study in biological psychiatry found that sleep restriction to 6 hours per night for 1 week increased IL-6 by 42% and CRP by 28%. Restoring sleep to 8 hours normalized inflammatory markers within 2 weeks. Sleep quality mattered as much as duration. Deep sleep suppressed inflammatory cytokine production. Intervention 4. Practice stress reduction through meditation, mindfulness, or other techniques. A 2018 study in brain behavior and immunity found that 8 weeks of mindfulness meditation reduced inflammatory gene expression by 34%. CRP dropped by 19%. The meditation altered the stress response, cortisol normalized, and cortisol-driven inflammation decreased. Intervention 5. Supplement with omega-3 fatty acids, EPA and DHA at therapeutic doses. A 2020 Cochrane review found that omega-3 supplementation at 2 to 4 grams per day reduced inflammatory markers by 15 to 25%. The omega-3s competed with omega-6 fatty acids for incorporation into cell membranes. They shifted the balance from pro-inflammatory to anti-inflammatory signaling molecules. Intervention 6. Optimize gut health through probiotics, prebiotics, and fermented foods. A 2021 study in gut microbes found that gut dysbiosis drove systemic inflammation. Restoring beneficial bacteria reduced endotoxin leakage, LPS levels dropped, and systemic inflammatory cytokines decreased by 30 to 40%. Probiotic supplementation plus dietary fiber produced the best results. Intervention 7. Minimize environmental toxin exposure, including air pollution, cigarette smoke, and endocrine disruptors. A 2019 study in environmental health perspectives found that air pollution exposure elevated CRP by 18% and IL-6 by 24%. Reducing exposure through air filtration, avoiding high-traffic areas, and eliminating indoor pollutants lowered inflammatory markers measurably. When all 7 interventions are implemented, the cumulative effect is profound. A 2024 study in Nature Aging followed adults over 65 who adopted all 7. After 1 year, their inflammatory markers had normalized. CRP averaged 0.8 milligrams per liter, down from 4.2 at baseline. IL-6 dropped from 3.8 to 1.4 picograms per milliliter, and biological age measured by DNA methylation clocks decreased by an average of 5.3 years. They were biologically younger despite being chronologically older. The 7 signs your inflammation is already out of control are persistent fatigue, unexplained weight gain despite diet and exercise, brain fog and concentration difficulty, morning joint stiffness, disrupted non-restorative sleep, digestive dysfunction, and skin changes including slow healing and easy bruising. These are not normal aging. They are manifestations of inflammatory cytokines damaging multiple organ systems. Standard medical tests miss chronic inflammation in 77% of cases. You need specific inflammatory biomarkers, high sensitivity, CRP, ESR, IL-6, TNF-alpha, omega-3 index. When these are measured, you can identify inflammation before it causes irreversible disease, and inflammation is reversible. Anti-inflammatory diet, regular exercise, quality sleep, stress management, omega-3 supplementation, gut health optimization, environmental toxin reduction. These 7 interventions reduce inflammatory markers by 50 to 70% within months. They prevent the cardiovascular disease, dementia, and cancer that inflammation drives, and they extend both lifespan and health span. If this video gave you a framework to identify and reverse the invisible process destroying your health, hit the like button and subscribe right now. This channel exists to give you the biology that prevents chronic disease. There is more coming about metabolic health, immune function, and the interventions that actually change outcomes. I will see you in the next one.